Section 75 of the 2006 NHS Act. So I will try to share my screen. Hopefully it all works. I'm just going to do a short presentation. I will not go into too much detail and then allow time for time afterwards for questions and any comments that you may have. So that's where we really want to focus the majority of this time. But the presentation helps to get kind of a general background and that make sure that we're all on the same kind of page on in terms of our understanding. So without further ado, and just by the way, I may not see any hands up or questions, but I'll try to answer them at the end of the presentation, and I'll keep it as brief as possible. So what is Section 75? Well, basically, this particular piece of legislation supports local authorities and NHS bodies to come together and enter into partnership arrangements where they can pool budgets and resources if they so wish to deliver certain NHS and health related functions. And those functions are actually very legalistically set in legislation, what that covers. And when under these arrangements, NHS bodies can carry out certain local authority health related functions, and local authorities can carry out certain NHS functions, and they can do this together and establish a pooled fund or pooled resources to deliver the partnership arrangement. And these are formal arrangements that the commissioners enter into, and usually these have to show a demonstrated improvement in the way those functions can be exercised if they're done individually. The partnership arrangements do not affect the liability of and accountability of the organisations. So basically, if a local authority takes on an NHS function, the NHS body still remains accountable for the delivery of that function. Yeah, and as I said, the partnerships can, rather than enter a pooled arrangement, they can just pay each other for the delivery of services under those particular functions. So why are we doing this review and what we hope to achieve from it? So we want to consider if we need to make any changes to existing legislation that further integrates use of pooled budgets. The government is and the department is very keen to encourage greater use of integrated care and arrangements that support partnership working across local authorities and the NHS. We also committed to, in the integration white paper published last year, I think, to review the legislation that covers pooled budgets and to consider ways we can simplify and update the regulations where necessary. We also using this opportunity to call for evidence to gain a better understanding of what other barriers are that are inhibiting further integration of pooled budgets, and whether any legislative changes could overcome these. And this review builds on many years of engagement with the system and partners on how integration is developing and what we can do more about improving that partnership arrangement. And also, as you'll be aware, that the new Health and Care Act gained royal assent last year in 2022, and we wanted to see how the partnership arrangements kind of operate now in the new commissioning environment of the NHS and local authorities. So what is the scope of this review? Well, it's a call for evidence. So we want to see what changes we need to make to legislation. We wanted to also look at there are certain NHS and health related functions which are currently excluded by regulations. So those functions cannot be included at the moment in Section 75 arrangements. And we wanted to gather evidence to see whether we need to widen the scope of health related and NHS functions that can be included in Section 75 arrangements. And we also, probably more relevant to this particular discussion, is whether we should consider widening the scope of organisations that can enter into these Section 75 arrangements. Currently, only local authorities, NHS bodies, and that includes NHS England, NHS Integrated Care Boards, NHS Foundation Trusts, and trusts are the only bodies that can actually form partnership arrangements under these regulations. And we also wanted to take this opportunity to, as mentioned earlier on, to consider what are the perceived barriers and what other things we can do to promote further use of integrated service delivery, and whether we need to look at whether we need to strengthen any of the or simplify the governance arrangements around Section 75 to further support commissioning of integrated care services. I'm not going to go too much about the engagement plan. This is part of a process that we're involved in talking to national stakeholders and national systems about our plans. And this is part of that process. We want to gain your views, and we're going to get opportunity to respond to the call for evidence at a later stage. In terms of timeline, the call for evidence now will actually hopefully go live tomorrow. So it's due to be published tomorrow after 2 p.m. I think. And once the call for evidence is published, I'm sure we'll share the link with you and your colleagues, and they'll be able to respond to that directly. We will then I think we've given 6 weeks to respond, 6 weeks and a few days. So the deadline for the response is 31st of October, and we will then take time to review all the evidence gathered from the call for evidence, and then we'll look to see whether any action needs to be taken following that call for evidence, and that could be either through changes in legislation or through further guidance and support to systems. So these are kind of the questions we really like you to focus on today if possible, and we're really keen to hear your thoughts and views and comments and any questions you may have. I'll try to copy these questions into the chat if that may help. So that kind of ends the presentation for this particular piece of work, and I'll try to copy the questions into the chat. Happy to answer any questions you may have.
Excellent. So I've just put the questions into the chat for you, but now the floor's very much open. So if any of the attendees would like to come forward with any initial thoughts, it might be worth having the questions still up on the screen, if that's possible, just so that everyone can have access to them. But would anybody like to come forward? I have had a few emails coming through, so I'll just quickly check to see if anyone has shared any comments through there.
Sorry, Fraser, if I share the screen, the slides, I can't see any hands up.
I can monitor the hand raising function, so I can do that for you.
Okay.
Excellent. Jude, would you like to come off of mute and provide any feedback?
Hi, thank you. In my experience of trying to work with integrating of commissioning in Surrey, I'm finding that we don't know where to start with Section 75. We're looking for best practice or other examples, people who've done it, and it just, or perhaps, you know, do something that we think is right. But just getting the document together and knowing what to put in it, what the elements, what we have, what decisions need to be made, etc. We really don't have I don't know where to find guidance on that. Is that something that something that exists, or that you would be looking to create?
That may be one of the things that we do more of about in terms of putting more guidance or making the information more accessible. The NHS England do have a portal called NHS Futures, but you do have to try to register on it, and it does have quite a lot of information for commissioners on Section 75. And you may have also heard of the Better Care Fund. So that's quite a large fund that's delivered with the NHS and local authorities, and it relies on Section 75. So if you've heard of the Better Care Fund, you would have probably heard of, well, you may not have heard of Section 75, but it's the legislation that underpins the Better Care Fund. But yeah, that's maybe something that we need to look at in terms of making it a bit more accessible.
Yeah, sorry, I say that as a local authority employee, and so not necessarily having access to the NHS materials that you've got. So, but obviously it's an NHS instigated document. So yeah, it would be good to have that more readily available across the organisations.
Yeah, sorry, I didn't realise you local authority. There's also the Local Government Association have quite a lot of resources on their website. It may be worth having a look there as well if you haven't had a look on that.
Thank you.
So I have had a few questions come in via email, and while not necessarily related to the ones on screen at the moment, I was wondering if you would be able to provide any feedback. So the first one is, how does a provider determine who is responsible for the inflationary uplifts? Will the engagement be led by either an ICB or a local authority? And what contract term does it fall under? Is it the Care Act or NHS standard contract?
That's a little bit tricky for me. I don't think we have the answers to that. I think that's a local contract kind of negotiations and decisions about the inflationary pressures that everyone's feeling. That's part of the negotiation. In terms of does it fall under the Care Act or the NHS, it all depends on which particular service it is, because they are slightly different and different organisations have different roles in commissioning different services. Some of them they can do it jointly, and it may be done by a Section 75 arrangement already. You may not be aware of it, but if they commission it jointly and you have local authority and the NHS involved in those discussions, it's likely that it was done through a Section 75 arrangement. I mean, there are also, local authorities and the NHS can have informal arrangements as well. Sorry, I don't have any more detailed answer than that for those particular questions.
No worries. That's great. Thank you. Andy, I see you put your hand up. Would you like to come off mute and provide any feedback?
Yeah. So I suppose it's just a kind of a bit of a live example. I'm also from Surrey, sit in the finance team, so I'm well aware of the Better Care Fund and the Section 75 around that. We're just actually currently doing a procurement piece for setting up a DPS, dynamic purchasing system, which will provide supported independent living for working age adults. And we're doing that jointly with our NHS colleagues, because obviously some of the people are funded by the NHS who use those services and some are funded by the council. And we are struggling to, we think we've got a way forward, but we've spent a lot of time. I think this is kind of one of the barriers that hinder the further use. We've spent a lot of time kind of working out whether we should have a Section 75 or not. And we kind of go around in big circles around governance and all of those kind of things about whether there should be a Section 75 or whether we, because it's a council-led procurement, whether we should just take our T's and C's and add a few NHS T's and C's to our current T's and C's, and that's a good enough contract to use, or whether we should have a formal Section 75 that says, for example, that we do take on the commissioning of those functions for the NHS. So I think some of the barriers are actually kind of the understanding of what a Section 75 can and can't do, and you then use a lot of time and effort into those discussions rather than possibly looking at what you want out of the outcome, whether it's a Section 75 or not. You want good care for people, so a lot of time is used up in that commissioning process around contractual type things, which is all good and proper, but maybe like better, clearer guidance on that might be useful. I suppose that's my reflection.
Those are really important reflections, Andy. I think we are hearing, not just from yourself, but from other areas about the complexities of arranging a Section 75 arrangement. But also sometimes having those discussions, it may seem it takes up a lot of time, but it's about building those relationships as well. And that was
I agree. We've had some.
Yeah.
But it is about building relationships, and we've had some, I say challenging discussions with our partners. But like you say, that helps build the relationship, doesn't it? You know, in terms of understanding each other's viewpoints and getting forward on those things. So yeah.
Sorry, Hannah, do you want to come in on that?
Yeah, hi, I'm Hannah. I also work for the Department of Health and Social Care. I'm head of place policy and overseeing the Section 75 work. So just on those points, I think something that we've heard a lot from stakeholders is about the need for sharing best practice and sharing examples about how Section 75 arrangements can be used. So in the integration white paper, we did say that we would produce some guidance on pooled and line budgets. We have slowed down the timeline for that piece of work to kind of take into account the review that we're doing in Section 75. Originally in the integration white paper, we said we'd publish that by April of this year, but it seemed a little bit preemptive to produce something before we've done a proper review into those arrangements. So it's something that's very much on our radar, is about how we can share kind of good practice, how we can help to support organisations when thinking about what sort of commissioning arrangements are available, what sort of arrangements are available for pooling budgets, and the kind of parameters of those, because of course Section 75 is broader than just a pool fund. There's other things that you can pool, you know, like resources, and how you sort of think about that in terms of setting up services. So there is a piece of work that we need to do around that. So continuing to hear that is really helpful when thinking about how we structure that and take that work forward. But I just want to say it's something that we are very much kind of thinking about, and I think that will be something that we do address to support the work that we're doing here for the Section 75 review.
Thank you, Hannah.
Yeah, thank you, Hannah. That's really insightful. I have had another question in via email. However, I'm not too sure whether this again will be something you'll be able to answer immediately, or maybe we provide feedback in a follow-up email. But there's been a question which asks how many residents are currently funded under the Section 75 pool budgeting, if you know that, and then what different service types can be funded under Section 75, whether that will be residential care placements or nursing care placements or any of the other service types.
In terms of the first question, yeah, I think I don't have those figures on hand, and you may, you know, we'll have to look into that a little bit further on. But the Better Care Fund is quite a large fund, and it does fund some of those placements and in intermediate care, step down care, discharge, supporting patients being discharged from hospital. That's already something that but local authorities and local NHS commissioners fund through the either the Better Care Fund or additional Section 75 arrangements. The kind of which services, I think that's for local commissioners and local authorities to sit down together and work out, you know, where they feel comfortable that those services delivered jointly would add benefit to doing it individually. So we don't, in any of the legislation, prescribe what should and shouldn't be included, apart from the NHS functions which are set out in legislation and the local authority functions. So the functions are quite broad, but they are, for example, at the moment, you can't commission pharmaceutical services or dentistry, primary dentistry services through a Section 75 arrangement. But that's something that we're going to look at in terms of gathering evidence of whether there's a need to do that. So there are some excluded services, but the ones that you mentioned should already, I think, could potentially be covered, but it would be up to local agreement. If that helps answer your question. Not fully, but some of it.
No, that's great. Thank you. So I've just received another question as well. So as a provider, we accept nursing beds in good faith, but do have a challenge where FNC budgets are ICB controlled and the base fees are local authority controlled. They commission beds jointly but pay separately. The result is a delay in payment and the occasional challenge with regard to the eligibility of FNC at all. Would Section 75 support this?
We would hope so. because it's about how those two organisations work together. So yeah, have some kind of conversations with both of the NHS and the local authority about whether they should arrange those kind of services jointly, and if there's a will to do it, then there may be something they could look at doing, because it does make sense that it should be integrated, but we know that it doesn't always work in every single area. So it will depend on local circumstances.
On the back of that, then, would as part of this like review, would there be the possibility of further guidance in that, as mentioned previously, like best practice on how to make those work and have like successful case studies which can be replicated across England?
Yes, definitely, Fraser. I think it's something that we're going to be looking at further. I think that the evidence will probably accumulate in terms of greater understanding and case studies that will spread the use of those budgets. But I would encourage all the attendees on the call and their contacts that those examples that you've given, or the barriers that you perceive that are hindering some of your work or delivery of your services, if you can put that in the call for evidence, it will be taken into account into the whole evidence, and the more we gather, the more insightful we can be.
Although, can I just come in on specifically on the FNC component? I think that's something that we do need to explore a little bit more. I'm not sure if we're 100% clear about whether those are payments that come via a Section 75 arrangement, because I think they're payments that are usually made from the ICB direct to the care homes, aren't they? So there may be just a little bit more about the interaction that we need to work through between those arrangements and Section 75. But that's definitely something we can put on the list to think about and explore a bit further when we're thinking about the guidance.
That's brilliant, thank you. And just going on from an earlier point as well, definitely, if any of the attendees, and we'll be sharing this recording further as well, so please do try to provide as much case studies and give best practice as well. Do share that within the call for evidence, but then also do send any information you'd like to share to myself as well, and we can feed that back appropriately. Care England will be conducting a response to this call for evidence as well. So we'll be contacting members in due course to shape our answer as well. I'll be leading on that project. So you'll get a lot of emails from me, I'm sure, asking for evidence, but please do. This is a fantastic opportunity for us to make meaningful change, and it's really important that everyone's voice is heard on this. I guess another question, talking from a representative body perspective, the best practice and the case studies, will there be like a centralized location where they will be shared? Because I think it will be really powerful for us as well to be able to share these case studies beyond what you're already doing, sharing with them, because I know that I'm sure that you'll be putting them in your bulletins and your website as well. It would be great for us to share these case studies as well when we're engaging with ICBs or different NHS bodies or local authorities. So that, just from my perspective, that would be quite helpful.
So, sorry, Fraser, you shared the case studies after the review, or as part of the package?
After the review, I guess, if it would, once you've collected all the responses after, I believe you said October 31st, and then there'll be time obviously for you to go through the reviews and go through all the information and evidence that has been presented to you. But maybe if there's any sections where you think, oh, this is a great case study, you could just take that isolated from their response and then just maybe have like a centralized hub almost somewhere of just best practice. Because I know that there's other variations of good practice and case study platforms which the Department of Health and Social Care do run. So that might be a point to consider.
Definitely will consider that. That's a good idea. Yeah.
Yeah, I think so. Part of the work that we're doing is not just about producing some, standalone guidance, but it's also thinking about how we can link into the sort of support, the peer support programs that are run by various organisations like Local Government Association, NHS Confed, to support places and organisations within places coming together to share that good practice and peer learning, support peer learning. So I think there's sort of two elements to it. There's the, what are the issues that we need to address and support places with in understanding and using pool budget arrangements, and then how can we best disseminate that knowledge and support that peer learning, which could be through some guidance, but also through accessing those forums. So yeah, definitely.
Thank you for that. That's brilliant to hear. So I just wanted to ask any more of the attendees if they had any more feedback to provide. Please do. This is a great forum and opportunity to do so, but also as well, please do respond to the call for evidence itself, which is launched, which will be launched shortly. But the spotlight is on everyone now, so if anyone would like to provide anything, please do.
Has Andrew got his hand up? I saw a hand go up somewhere.
Yes, Andrew, if you'd like to come off mute.
Yeah, hi. Also from Surrey, so you can tell we're here en masse as we try and work out some of our next steps in the integration space. I guess one of the things that we're experiencing is is kind of the challenge of entering kind of pooled arrangements in a way that doesn't mean that you're just duplicating everything and duplicating governance and duplicating accountability, that actually just makes it potentially more muddled and a lot more cumbersome on everybody. And I know you've got points in here about wanting to, potentially reviewing legislation to support that. So I'm not sure I've necessarily got an answer, but just to I guess it's just to add that feels very live and very real, especially in the, ICBs or new organisations. Everyone is trying to work out the place-based agenda and what that means. That I think it's just incredibly relevant and important context that either legislation could support, or maybe it's not really about the legislation and it's wider than that, and it's a different sort of approach.
That's a really good point, Andrew. And I think those complexities, unfortunately, are something we will obviously want to hear about, but I'm not sure we'll have all the answers. Some of it comes down to the different routes of accountability. Local authorities are accountable in a different way than the NHS. So it's trying to, how do you then bring those two different routes of accountability to work together? So I'm not sure we can sort the governance out straight away. What we would like to see is them working in more partnership together. They may mean that there's duplication in terms of governance, but they're doing it jointly. That would be the kind of what I would suggest. But yeah, we would definitely want to hear if there's anybody has a solution to that different level of accountability. It'd be quite interesting to hear.
I was just going to say, because it literally just popped into my head, I wonder if there is scope for any review and change in the Section 75 legislation that decreases the burden on local ICBs reporting to NHS England. And I think just in terms of using a process so there's a little bit more local accountability, so the local partners can get on with things without it feeling like it, potential ICBs also being, maybe hamstrung, maybe a bit of a strong way, by quite top-down arrangements. And there, I try not to go too political or anything like that, but I think that's a very live and real challenge as well.
And that's something that we heard through the Hewitt review as well. and that will probably feed into this review as well. But we also have to have an understanding that there is going to be some level of accountability, because for example, the Better Care Fund is quite a significant chunk of public money. So we're not going to be able to get away with no kind of level of accountability or accounting or targets, unfortunately. But we will try to look at how we can minimize that and make it easier as possible at local level.
I guess that would be one of the differences between local government and ICB in terms of the level of reporting that's required to go back up to a central position.
Yeah, we do hear that, definitely, and it'd be good to hear that in this review as well.
Thank you.
There's been a question raised into the chat, which is there is so much legislation that local authorities and ICBs have got to adhere to already. How can we ensure that Section 75 isn't lost in the massive information already out there?
Yeah, and we were conscious of that when the Health and Care Act came through. We didn't want to rush through with loads more additional guidance and loads more information for local areas, because they were obviously dealing with already there's a lot of legislation in ICBs. I don't think this review will answer all of those questions about the other different sets of legislation and reporting requirements, but it would be good to hear how we could potentially reduce the burden on local authorities and the NHS in operating Section 75, but in an accountable and responsible manner. I think that's the key kind of question, is getting that balance right.
Just to come in on that as well, I mean, in terms of how do you ensure that it's not lost in the massive information, I think there's a difference between the things that local authorities and ICBs have to do and the things that you can use to enable better integrated services. And I think it's to try and sort of keep that in mind, that Section 75 isn't a mechanism that you have to use, but it's one that we would like to encourage and promote further use of, because we think it can really support integrated working arrangements. So I guess it's trying to use Section 75 when thinking about your sort of service deliverables and how you're working with partner organisations to deliver your aims and your objectives, and those duties that you have. It's a sort of mechanism for supporting the delivery from local authorities and ICBs and in coming together. So it's trying to sort of like differentiate it, I suppose, in that way. And I think that's where kind of the sharing of good practice could also come in, an example, so you can see how other areas are using it, and then it can help you to sort of think about how that might, relate to your organisations in your areas. I think Section 75 is used quite a lot in sort of like learning disability services, mental health, community integrated teams, those sorts of services. But it would be good to sort of see it a bit more in other service areas as well coming through.
That's great, thank you. Whilst we wait for any more attendees to have any points, I just wanted to say as well that we have what we'll do is, once the call for evidence is published, I'm sure we'll be promoting it through our comms. The Department of Health and Social Care will be promoting it through their comms, but I'll also send everyone attending this session a follow-up email to confirm when the call for evidence has been published, and a link to where you can submit any evidence as well. So don't worry, I'll make sure everyone's aware of when it is published.
Thank you, Fraser. It's really helpful, because some of these are quite complex kind of questions and complex areas. So I'm sure the attendees and the wider community of Care England will want to have time to think about it and kind of consider their responses. So we understand that.
Definitely. And I think one thing which it would be great if we could get maybe an expression of interest in the chat is whether it might be worth, once the call for evidence has been launched, Care England could hold a feedback session maybe midway through the timeline of the call for evidence, so that people can come in, contribute any points or ideas or any thoughts that they may have, to help inform Care England's response, but then also if they need any wider support. So that is something we can definitely look at internally for members if that they would like that, and we'll follow up if this does happen via our communications. There has been one other question statement put into the chat, whereas do you think it might be an idea to get regional care groups to run sessions on Section 75 so people providing services have a better understanding, as it is quite complex?
Yeah, it's a good idea, and we'd hope that different areas would look at how they can, upskill and pass that knowledge on, and best practice would be really helpful. Yeah, and Hannah's right. Anything that promotes and facilitates understanding, I think, is better for the providers, the commissioners, for the patients at the end of the day as well, and the communities.
Definitely, and from a caring perspective, we are very keen to run sessions, produce small high-level summaries, briefings, whatever it may look like, just to make sure that everyone is well informed and can understand everything, because it's a changing landscape, and when very complex things like this do change, it can be difficult to make sure that all the up-to-date information is known. So there's definitely a part caring can play on that. So I haven't received any more questions as such from my inbox, and I can't see any more questions that have been put within the chat. So I think I'll ask again if there's any final comments people may want to ask. However, we can conclude this session early if other people have other things they need to get back to. So I'll hold the fort a little bit longer, but then we will look to close if there are no any further points, unless of course anyone from DHSC wants to add anything else beyond this feedback.
Just say we are very keen to hear Care England's views and the wider members' views in terms of what we can do to improve joint working and integrated care. So very keen to hear your thoughts. And this is a good opportunity because it's quite early in the process where we're formulating the policies and formulating the ideas, and this is a great opportunity to kind of have your thoughts and kind of influence that going forward.
So I don't think there is any more feedback to give. So I'll look to give 20 minutes back of everyone's days, because I'm sure we're all very busy. But I know that there's thanks coming from the chat, but from our perspective, I want to thank everyone for joining today, and I want to thank the department for agreeing to meet today and hold this session. I think it's been very useful, and I know I've mentioned this before, but please do respond to this consultation once it is published, and please do, if after this session you have any thoughts or any more feedback from these questions, please do follow up with me via email. I'll put the email into the chat, and then we can look to see from a caring perspective what other sessions we could hold on Section 75.
Thank you all for taking your time to listen to us, and thank you, Fraser, for giving us that opportunity to really kind of listen to Care England members and their thoughts. So thank you.
Thank you, everyone.
Bye.
Thanks. Bye.